Okay, so now, good morning, guys. Today we'll be discussing concepts of wellness and concepts of health and wellness located in chapter 1 of your health education book. So let's define health. So health is a word that derived from the old English word which mean is HL. So it means whole because health concern the whole person. So it's not just the physical aspect, but the mental, psychological, the spiritual, and emotional aspect of the patient should be put into consideration. His or her integrity, soundness, or well-being. It is holistic that includes different dimensions of health. So that's why where our patient is admitted in a hospital, we just don't look at the physical criteria of the physical domain of the patient. We have to explore deeper kung unsay ang problema sa other aspects of health. And as you can see, guys, this is the diagram of health. Environmental and the societal aspect, as you can observe, it is located outside of the circle. It is because this is beyond the control of the individual. So it means kaning mental, social, spiritual, physical, sexual, and emotional aspect makontrol na siya nato as a person. But this environmental, we cannot control the weather, the climate, the environment we are currently living in, and that's the same time the societal aspect. Each dimension of health, we will be discussing it one by one later on. Okay, so always remember, why is it located outside of the circle? It's because beyond na siya makontrol sa isa ka tao. Doon na siya hold gamay, but it's not like iyahadyod tanan ang control sa kaning aspect of health. So, dimension of health. First is environmental. It includes housing, sanitation, transport, pure water. So, it means the environmental aspect that includes this example must also be healthy. Kasi pag dili ni sila included sa environmental aspects sa patient, that might lead to illness, diseases, infections, and other diseases. Societal as well is the basic infrastructure necessary for health, so it's much broader in scope. How you perceive your outer surrounding, like that's it, the basic infrastructure where you are living in. Next is the individual dimension, which is control na siya sa tao. Physical health, fitness and not being ill. The mental health, self-esteem, feeling good, and coping skills. So it's very important that you have these coping skills. It's okay for us to feel disheartened, to feel down, to feel lonely, but of course dapat kabalutan mo cope nga certain stage of life, certain dili na ta makaabot sa depression. That's why, guys, individuals who are suffering from depression that may lead to suicide and may lead to death, that's those type of person nga wala na, dili na healthy ilang mental aspect of health. That's why na commit na nila. Emotional health, express feelings appropriately, feeling of being loved. So importante po, sorry, na we as an individual, we feel na gilove po ta sa lain tao. It doesn't necessarily sa opposite sex gikan na affection, maybe from family, from our friends, from our classmates, from our colleagues. So that's it. Doesn't necessarily na kailangan dyan mo manguyab just to feel love, because love is everywhere. You can find it from your family, from your parents, from your children, like that. Social health, it means support system for family and friends. No man is an island. So that is why we are encouraging patient. Kasi guys, those patient, diba, I've mentioned this one when way back then when we are discussing TFN. Those patients who don't have enough support system in the hospital, ang ilang recovery is dili nga nakapaspas. Unlike those patients of ours na, their parents, their partner, na sa ilang tapan, makadali sa ilang recovery. Spiritual health naman, it's a recognition of supreme being. So it doesn't mean na lahi man tao spiritual belief. So we have to respect that because that's part of the spiritual health of a certain person. Sexual health naman refers to the acceptance, the ability to achieve a satisfactory expression of one's sexuality. So, sexual health doesn't mean like makikuan sa lain sa opposite sex. It doesn't actually nung baga dili lang dira na tana kumbaga na aspect. Sexual health like you're accepting for who you are, like feeling ni mo lalaki ka that, but of course I feeling your sexual is lalaki but feeling ni mo you are a girl or you like babae ka, then you will have to accept that sexuality because that might affect your health as a person. So, though lalaki ka but your sexuality is a female, you have to accept that and let the other person also accept that because that might complete for who you are as a person. Okay, the definition of the World Health Organization defines health as a state of complete physical, mental, and social well-being and not merely the absence of disease and infirmity. Do you think it's ano guys, kanang attainable? The definition of WHO, somehow there are a lot of opposition with regards to this definition kasi naaman jud tao nga yeah, we experience along the way sa atong life as we go along, we really experience being ill, having this particular disease. So this definition, there are a lot of opposition to this. But as for our individual learning, this is the definition of World Health Organization about health. But there is an opposition as what I've told you. Cottrell, claims that just a goal to strive for can never be achieved since no one can attain a state of completeness. So, di yun nato na ma-attain. So, because we are just human, we are just striving for to attain so sa kaning definition sa WHO, which is I think na dili kayo siya attainable. It's because we as a human being we tend to experience sickness, illnesses, and infections. But of course, we have to strive. Spiritual dimension must also be included. So according to Cottrell, spiritual dimension must be included in the definition of WHO. OREM, the self-care deficit theory. Can you still remember OREM? Dorothea OREM defined health as a state characterized by soundness and wholeness of human structures, bodily and mental function. So that's it. So you really have to stay healthy physically, but at the same time your mental well-being should correspond to your physical aspect of health. There is what we call also a modern concept of health, refers to OLOF or the optimum level of functioning. So what is OLOF? It is the optimum level of functioning. So we as a person, we try to attain or we try to reach this optimum level of functioning. Now, what are these factors that affect our optimum level of functioning? So mao ni unsa tong mga reason nga nang lisod ta og attain aning all of. The first one is political, power and authority. Our safety, we're being oppressed and we lack people empowerment. Yeah, specifically those person who are depressed, oppressed, and deprived from basic necessities. Mao to nga per mga tao nga dili gyud nila ma-attain kanang ang optimum level of functioning. So behavioral, your habits, your lifestyle, healthcare, and child rearing practices. Because who you are as a person as you grow up, that's nag-reflect na siya guys kung unsa ka gipadako sa imong parents. That might also affect your behavioral system. That might affect you as a person. Your habits, if you are like smoking, lifestyle nimo, kung drinking a lot of alcoholic beverages, so that might also affect you as a person. Next is hereditary, genetically influenced disease and risk. So congenital defects and health risk. So there are two, when you reach third year, guys, there are predisposing factor and the precipitating factor. Okay? Um those factors you cannot actually change. Okay? Precipitating is somehow your lifestyle, your habits, your predisposing kana tong nakuha gani mo sa imong ancestor, nakuha nimo sa imong parents. Like na diabetes mellitus type 1 imong parents or imong mother, imong father, there is actually a tendency na ma-acquire nimo na siya. It's because it's part of your genes sa imong mama papa, so makuha nimo na siya. Na tendency but not 100% na ay mga predisposing factor for you to acquire this particular infection or particular diseases. Next is the healthcare delivery system, effective provision of essential healthcare services. We cannot be sure, guys, especially katong mga nagtuyo sa mga far flung areas, katong mga bukid-bukid na gyud, they are being deprived from basic healthcare services, and they wasn't aware, so wala siya kabalo, and they are not being properly educated, especially sa mga prenatal care, um, immunization sa mga infants. So dili sila aware ana, so that's why they are being deprived. So kailangan na sila, that's why they program now in the community, di ba, na mga nurse in the barrio, doctors in the barrio, so that those healthcare professionals are going to help those people in need, specifically dito mga nagpuyo sa bukid-bukid. So always remember that our purpose is to promotive, preventive, curative, and rehabilitative. So this is our scope as a nurse, and as a nurse, as a future nurses. So mao ni ato ang scope. So next is environmental influence. Of course, if pollution, how can we attain optimum level of functioning when we are living in a squattered area, in a crowded places, communicable diseases due to poor sanitation, smoking, radiation that lead to destruction of environmental sources. So we cannot really attain optimum level of functioning if this will occur. Next is socioeconomic influence. Families in lower income group are the ones mostly served. So, di ba, as far as you can observe, for peace, di ba, this program of the government, ginatabangan tong kumbaga, mga low income groups of people. So, this is to provide, they also provide employment, education, and housing. Next, health as a basic human right is embedded in Universal Declaration of Human Rights. Article 25, Section 1 states that everyone has the right to a standard of living adequate for the health and well-being of himself and family, that primarily refer to food and clothing. So, Philippine Constitution 1987, the Article 13, Section 11 states that the state shall adopt an integrated and comprehensive approach to health development. The state shall endeavor to provide free na panay medical services to people. So that's why medical basic services, healthcare services are free now sa atong generation. It's because of this article. It's because of this constitution. Okay, World Health Organization 1995 believes that government have a responsibility for the health of their people, which can be fulfilled only by provision of adequate health and social measures. We all know that the government now is trying to give everything to the people. They're trying to innovate a lot of protocols, a lot of guidelines for the people itself. So we just have to, because we have the learning, we really have to educate the people surrounding us, specifically if wala sila rin kabaluan na mga programs sa government, so ato silang i-encourage. And the three basic positive concepts of health: reflecting concern for the individual as a total person, and then placing health in the context of environment, equating health with productive and creative living. So that's the three basic positive concepts of health. So So health and wellness as conceived in today's world. So Dunn, 1977, emphasized high level of wellness as an integrated method of functioning which is oriented capable of. It is the ability to maintain a continuum of balance and purposeful direction within the environment where she is functioning. So we really have to have this balance. We really have to have this direction, not just a direction but a purposeful direction sa ato ang environment kung asa man ta nag-function. So health actually determined by genes, age. This genes is a predisposing factor. It means we cannot actually change it. We cannot alter it. Kasi when you reach third year, guys, may mga ma-encounter na mga sakit, which I think is a most siya, mas challenging siya nga subject. Genes and age, always remember, is a predisposing factor. It means you cannot change it. But those habits, lifestyle, your like drinking, smoking, are just precipitating factors. It means you can change it, you can alter it for the betterment. Wellness naman is the decision you make about how to live your life. Okay? Although wellness, health is this, but wellness, although you are sick inside you, you are battling with cancer, with chronic illnesses or conditions, as long as you perceive yourself as a healthy individual, that's what we call wellness. And wellness is a state of mind, awareness of the choices available for a healthy lifestyle. So it's like in your mind na I am well, okay? I am okay. It's like how you function in your activities of daily living. So that's wellness. So it doesn't mean you're having cancer, you're having diabetes mellitus, you are experiencing chronic hypertension with so many more diseases. You are not well. It's just a state of mind. So nara na sa imong sarili unsa ka mo pag-perceive sa imong sarili, sa imong condition. And it is the integration of body, mind, and spirit. So that would be all. The definition of health education, the principles, the purpose of health education, why it's being incorporated sa nursing curriculum. We will be discussing that in this chapter 2 of your book. So I will just upload the second chapter of the discussion. Just make sure that you watch this, because on your examination day, all of the questions I'll be basing the questions here in my PowerPoint presentation. So make sure that you've watched these slides and you observe something, you learn something about this discussion. So thank you guys and have a good day.